Do you want to know what are the basics of metabolism of drugs? Let's see through this lecture. I'm Dr. Sehrish Zaffar and I welcome you to Key to Pharmacology. Let's see what is drug biotransformation. There are multiple products entering our body in the form of food or drugs. All of these foreign substances are generally called xenobiotics. Once the drug enters the body, the process of elimination begins. What is the difference between elimination and excretion? Excretion is removal of the drug or its metabolites from the body. They leave the body in form of some secretion like urine or feces or sweat or anything. Elimination means that the active form of drug is no more available. This can either be excretion or metabolism. There are three main routes of elimination: hepatic, biliary and urinary. Now basically drug biotransformation, it involves enzymatic conversion of one drug molecule into another form. By changing it into another form can have multiple outcomes. An active drug can be converted into an inactive drug. An inactive drug can be converted into an active drug, or an active drug can be converted into another active drug. Why do we need biotransformation? The basic problem is that when we talk about the absorption of the drugs, we say that the drugs should be lipid soluble. That lipid solubility enhances the absorption and movement of the drug throughout the body. But when it comes to removing the drug from the body, we need to decrease that lipid solubility so that it is not reabsorbed from the renal tubules. That is why we have to increase the polarity. We add some polar compound or we unmask some polar compound so as to increase the water solubility of the drugs so that they will not be reabsorbed from the kidneys anymore and they will be radically excreted. Do all drugs need biotransformation? The answer is no. Only the drugs that will not be eliminated naturally because of bigger size, because of high lipid solubility will need biotransformation. Where does biotransformation occur? The primary site is liver. However, multiple sites of metabolism are there inside the body, including the gastrointestinal system, which includes the intestinal wall, the intestinal lumen, the portal circulation, or in the lungs. There are multiple drugs that are excreted in the breath, which is the basics for the alcohol breath test also. Drug can be eliminated through the skin, kidneys, brain as well. For example, the monoamine oxidases, which are oxidizing the neurotransmitters. The route through which the drug is administered also has a role in metabolism. For example, अगर एक drug को हम direct intravenously inject कर देते हैं, it is going to bypass all the sites of metabolism that are in the portal circulation or the intestinal wall and in the liver also. Only when it passes the liver after circulating through the body, then it is going to be metabolized. लेकिन अगर हम एक ड्रग को ओरली देते हैं, it is going to face the metabolism at the level of GIT, portal circulation, and then it is going to enter the liver first, and it is going to be metabolized, the metabolism before reaching the systemic circulation, which is called the first pass effect. So obviously oral route के साथ drug जो है उनका pre-systemic metabolism increase कर जाता है. Certain drugs they pass through the liver. अगर orally उनको administer किया जाए, they enter the circulation, portal circulation, they go to the liver, then they go to the systemic circulation. But वो liver में बहुत कम metabolize होती हैं. So we say they are low extraction drugs. But there are certain drugs जो बहुत ज़्यादा amount में liver metabolize कर देता है before they reach the systemic circulation, and we say these are the high extraction drugs. The high extraction drugs generally have a very low bioavailability and are often not effective when given orally क्योंकि बहुत ज़्यादा metabolize हो जाती है and very small amount reaches the systemic circulation. So it is ineffective to produce therapeutic results. There are two types of metabolic reactions: phase 1 reactions and phase 2 reactions. Phase 1 reactions essentially convert the parent drug into a more polar metabolite. How do they do that? By adding or unmasking a polar functional group. For example, an amino group or a hydroxyl group or a sulfhydryl group. कोई भी ऐसा group या तो already उस drug के structure में होगा, there will be just a little modification in phase 1 reaction जिसकी वजह से वो group expose हो जाएगा. और या फिर ऐसी drug होगी जिसमें वो molecule नहीं है तो उसको add कर दिया जाएगा in order to increase the water solubility and polarity of the drug. Phase 2 reactions are called conjugation reactions, in which some group is added, some organic group is now conjugated to these exposed functional groups, जिसकी वजह से water solubility enhance कर दी जाती है और drug को readily excrete करा दिया जाता है. क्या सब drugs पहले phase 1 and then phase 2 reaction में जाएंगी? No, not necessarily. क्या सब drugs phase 1 में ज़रूर जाएंगी? No. क्या सब drugs phase 2 में ज़रूर जाएंगी? Again, no, कोई hard and fixed rule नहीं है. A drug can bypass phase 1 and can directly be conjugated in phase 2 and then excreted. Or a drug can be metabolized in phase 1. This metabolism in phase 1 can increase or decrease the activity of the drug, which is then conjugated in phase 2 and then excreted. एक ये भी possibility है कि एक drug ना तो phase 1 में जाए ना phase 2 में जाए. It is a small molecule, it is a water soluble molecule and it is excreted by itself without passing any of these reactions. The only purpose of all these reactions is to decrease the lipophilicity and increase the hydrophilicity of the drugs. Is it a fixed rule that phase 1 will always occur before phase 2? No. Phase 2 reactions may actually precede phase 1 reactions. And a typical example is the anti-tubercular drug isoniazid. Isoniazid first undergoes acetylation, which is a phase 2 reaction, and then it undergoes hydrolysis, resulting in formation of a hepatotoxic metabolite, which is very important when we talk about the clinical efficacy and toxicity of the antituberculous drugs. Phase 1 reactions involve oxidation, reduction, hydrolysis, and deamination. All of these reactions are generally found in the smooth endoplasmic reticulum of the liver, and they are not very selective. A very small number of enzymes can metabolize multiple compounds. Most of these reactions are metabolized by cytochrome enzymes. What are the outcomes of phase 1 metabolism? Either a parent drug molecule, which is active, can be converted into an inactive drug molecule, or an inactive drug molecule, which is called a prodrug, can be converted into an active drug molecule, or an active drug molecule can be converted into an active metabolite. And lastly, an active drug molecule may result in formation of a toxic metabolite. This table shows the various examples of phase 1 drug metabolizing reactions and the substrates involved. A very important set of enzymes is called mixed function oxidases. अब ये जो mixed function oxidases हैं, ये एक certain system है, enzymatic system है, which requires cytochrome P450, P450 reductase, NADPH, and molecular oxygen. Now we have got two types of mixed function oxidases. One is a flavoprotein containing enzyme and one is the heme protein. The flavoprotein is NADPH cytochrome P450 reductase and the hemoprotein is cytochrome P450. Majority of the phase 1 reactions are carried out by the cytochrome P450 enzymes. Generally, we do not talk much about the cytochrome enzymes at the undergraduate level, but talking about the postgraduate classes, we have multiple cytochrome enzymes, out of which cytochrome 3A4 and 3A5 is the most abundant, followed by cytochrome 2D6, 2E1, 2B6, and then there are multiple other cytochromes as well. The phase 2 reactions are conjugation reactions in which an organic molecule like glucuronic acid or acetate or sulfate or methyl group is added to an already exposed polar group in the drug molecule. These reactions most often cause increased water solubility and increase the excretion of the drug in the urine. The most common outcome of phase 2 reactions is excretion of the drug. But in some cases, a drug molecule can be activated after phase 2 reaction. For example, minoxidil is converted into minoxidil sulfate, which is the active form of the drug. Similarly, morphine is converted into morphine 6-glucuronide, which is also an active metabolite. Sometimes a reactive product can also be formed. As we have already talked about isoniazid, isoniazid after undergoing N-acetylation followed by the phase 1 reaction can result in formation of acetylhydrazine, which is hepatotoxic. These are certain examples of the phase 2 drug metabolizing enzymes and their substrates. The common phase 2 enzymes include glutathione S-transferase, N-acetyltransferase, sulfotransferase, thiopurine methyltransferase, UDP glucuronylyl transferase. Let's see what are the various factors which can affect the drug biotransformation. Genetics, age, gender, rate of metabolism, nutrition, diseases, drugs, dose, route of administration. There are numerous factors which can affect the rate of biotransformation or the nature of biotransformation in the body. Let's start off with the individual differences. We all have talked about it. कुछ लोग कहते हैं कि जी हमारे अंदर painkillers they are not effective. कुछ लोग कहते हैं कि no, we get too many side effects with the painkillers. Some people say we can have dizziness or headache after one dose of certain drugs. Some people say no matter if I take 2 tablets, I don't feel any effect. I don't feel this drug is giving me any benefit. Why? This is all because of the individual differences in the metabolism. कुछ लोगों के metabolic rate ज़्यादा है, कुछ लोगों का metabolic rate कम है, and they are metabolizing the drugs at different rates, resulting in sometimes toxicity or sometimes therapeutic failure. Then there are genetic differences. Genetic polymorphisms are forming the basis of personalized medicine these days. हम सबके genetics different हैं. The enzymes are different from one another. Differences in enzyme that occur in more than 1% of the population are called polymorphisms. Because of these polymorphisms, some drugs are metabolized at a faster rate. So we say that these people are rapid metabolizers. And some enzymes metabolize the drugs at a very slow rate. And we say they are slow metabolizers or poor metabolizers. Depending कि किस पेशेंट में कितनी स्पीड में कोई ड्रग मेटाबोलाइज हो रही है, दिस कैन आइदर रिजल्ट इन थेरेप्यूटिक फेलियर और इट कैन रिजल्ट इन एडवर्स इफेक्ट्स. अगर ड्रग बहुत ज्यादा स्पीड पे मेटाबोलाइज होगी तो थेरेप्यूटिक फेलियर हो जाएगा. ड्रग बहुत ज्यादा मेटाबोलाइज हो जाएगी, क्लिनिकल इफेक्ट नहीं आएगा. और या फिर ड्रग अगर बहुत स्लो मेटाबोलाइज होगी तो इट कैन कीप ऑन एक्यूमुलेटिंग इन द बॉडी एंड कॉज टॉक्सिक रिएक्शंस. Interestingly, the human gut microbiota, जो हमारे नॉर्मल फ्लोरा है गट का, दैट कैन ऑल्सो ऑल्टर द मेटाबॉलिज्म ऑफ ड्रग्स. फॉर एग्जाम्पल, हमारे पास कुछ बैक्टीरिया हैं जो हाइड्रोलाइसिस रिएक्शंस और रिडक्शन के रिएक्शंस जो हैं वो कैरी आउट कर रहे होते हैं. द ड्रग्स आर मेटाबोलाइज्ड बाय दोज माइक्रोबायोटा. फॉर एग्जाम्पल, डाइजॉक्सिन इज एन एंटी एरिथमिक. हमारे पास एक कार्डियक ड्रग है डाइजॉक्सिन, जो कि बैक्टीरिया जो गट में है उसको मेटाबोलाइज करते हैं. इन केसेस जिसमें गट माइक्रोबायोटा अपसेट हुआ होगा, उसमें डाइजॉक्सिन का मेटाबॉलिज्म ऑल्टर हो जाएगा एंड मोर ड्रग कैन बी एब्जॉर्ब्ड एंड इट कैन कॉज टॉक्सिसिटी. सिमिलरली, there are drugs like tetracycline, erythromycin, which alter the gut microbiota and they can influence metabolism of other drugs. The diet and the environmental factors have a huge impact on metabolism. How? There are charcoal boiled foods. There are certain vegetables जो cytochromes को induce करेंगे, उनके metabolism के rate को enhance कर देंगे. We have grapefruit juice which inhibits the cytochromes and decreases the metabolism of certain drugs. Cigarette smoke causes induction of certain enzymes and increases the metabolism of certain drugs. There are certain people who are exposed to industrial chemicals and these chemicals can alter the drug metabolizing capacity of enzymes. Age and gender. This is very natural. Extremes of age are always vulnerable. बहुत छोटे जो बच्चे होते हैं उनके अंदर लिवर अभी completely develop नहीं होता, so उनकी मेटाबोलाइजिंग कैपेसिटी कम होती है. जो बहुत ओल्ड पॉपुलेशन है उनके अंदर लिवर की एक्टिविटी डिक्लाइन कर जाती है विद एज. सो बोथ ऑफ दीज हैव लिमिटेड capacity to metabolize the drugs and the chances of toxicity can be higher. Now, certain drug-drug interactions can also alter the metabolism of the drugs. इसमें most important examples that we have include enzyme inducers or enzyme inhibitors. There are certain inhibitors of intestinal P-glycoprotein as well, जो कि एक efflux pump होता है. Enzyme induction essentially means increasing the rate of metabolism of drugs. Most commonly ये P450 cytochromes के rate के बारे में हम बात कर रहे होते हैं. Drugs or any compounds which are going to enhance the rate of metabolism are called enzyme inducers. For example, phenytoin, rifampicin, alcohol in some cases, they are all inducers of the metabolism. Contrary to this, enzyme inhibition means decreasing the metabolizing capacity in liver. ये cytochromes के metabolism की जो speed है उसको decrease कर देती हैं these drugs. For example, amiodarone, ketoconazole, erythromycin. There are certain drugs which are called suicide inhibitors. ये क्या करती हैं suicide inhibitors? They bind to the cytochromes and they get destroyed, but they destroy the enzyme as well. So ये अपने आप को भी destroy कर देंगे, लेकिन ये enzyme के structure को भी destroy कर देंगे and they will not let the enzyme to metabolize other drugs. बहुत इंपॉर्टेंट है ये एंजाइम इंड्यूसर्स और एंजाइम इनहिबिटर्स बिकॉज दे कैन अफेक्ट द क्लिनिकल आउटकम ऑफ अदर ड्रग्स. एक पेशेंट अगर एरिथ्रोमाइसिन ले रहा है, व्हिच इज एन एंटीबायोटिक, इट कैन कॉज इनहिबिशन ऑफ एंजाइम्स, द मेटाबोलाइजिंग एंजाइम्स. और वही पेशेंट अगर कोई कार्डियक पेशेंट है, वो साथ में कोई और मेडिसिन लेता है, वो डायबिटिक पेशेंट है, वो कोई और मेडिसिन लेता है, तो उनका मेटाबोलिज्म ऑल्टर हो सकता है, डिक्रीज हो सकता है बिकॉज दीज आर एंजाइम इनहिबिटर्स और उन ड्रग्स की टॉक्सिसिटी हो सकती है. सिमिलरली अगर कोई एंजाइम इंड्यूसर ले रहा होता है तो एंजाइम इंडक्शन की वजह से रेट ऑफ मेटाबॉलिज्म बढ़ जाता है और हो सकता है कि कोई और ड्रग जो वो पेशेंट साथ में ले रहे हो उसकी एफिकेसी कम होना शुरू हो जाए बिकॉज द ड्रग इज बीइंग मेटाबोलाइज्ड एट अ वेरी फास्ट रेट. Another important factor is enterohepatic recycling. कुछ ड्रग्स जो लिवर में ग्लूकुरोनाइड कॉन्जुगेशन के थ्रू फेज 2 रिएक्शन से मेटाबोलाइज होती हैं, दे आर देन डिस्पोज्ड ऑफ थ्रू द बाइल। अब ये बाइल में जब आती हैं, ये बाइल इज एक्सक्रीटेड इनटू द ल्यूमेन ऑफ द गट। वहाँ पे हमारे पास सर्टेन माइक्रोबायोटा होते हैं, बैक्टीरिया होते हैं जो इन ड्रग्स को डी ग्लूकुरोनाइड कर देते हैं, और दोबारा से जो एक्टिव पेरेंट मॉलिक्यूल है, जो ग्लूकुरोनाइड कंपोनेंट है, वो उसका हटा दिया जाता है और एक्टिव ड्रग मॉलिक्यूल इज रीअब्सॉर्ब फ्रॉम द स्मॉल इंटेस्टाइन, जिसकी वजह से एक सर्टेन अमाउंट ऑफ ड्रग कीप्स रिसाइक्लिंग। वो मेटाबोलाइज होती है बॉडी में, ग्लूकुरोनाइड कॉन्जुगेशन होती है, लेकिन जब गट में आती है फिर डी ग्लूकुरोनाइड हो जाती है और फिर से रीअब्सॉर्ब हो जाती है। यहाँ पे अगर गट माइक्रोबायोटा अपसेट हो जाए तो ड्रग की एलिमिनेशन ज़्यादा हो जाएगी और उसकी क्लिनिकल एफिकेसी कम हो जाएगी। द मोस्ट डिलीट्रियस effect of metabolism is production of a toxic metabolite. It is also very common, unfortunately. कभी कभी ड्रग मेटाबॉलिज्म सिर्फ ड्रग को इनएक्टिवेट नहीं करता, बल्कि इट कैन लीड टू फॉर्मेशन ऑफ अ टॉक्सिक कंपाउंड विच कैन डैमेज सर्टेन सेल्स। मोस्ट कॉमनली जब लिवर में ऐसे मेटाबॉलिज्म्स होते हैं तो लिवर सेल्स खुद बहुत जल्दी डैमेज होते हैं, लीडिंग टू हेपेटिक इंजरी एंड हेपेटोटॉक्सिसिटी। An important example of this is acetaminophen when it is taken in large doses. Acetaminophen क्या है? Panadol, paracetamol, the simple painkiller antipyretic drug which we all commonly take over the counter. Generally it has a very safe therapeutic profile. तो कुछ toxicity के ज़्यादा chances नहीं है, कोई बहुत ज़्यादा side effects नहीं हैं. But अगर इसको बहुत ज़्यादा large amount में ले लिया जाए, it can lead to formation of a certain compound which can cause hepatic injury. How? Normally, acetaminophen is conjugated through glucuronide conjugation and sulfate conjugation और harmless products बनते हैं. But when a certain large amount of drug is taken at once, वो lethal dose ले लें, बहुत ज़्यादा tablets इकट्ठी ले लें, for example बच्चों के अंदर toxicity हो जाती है accidental overdose की वजह से, तो वहाँ पे क्या होता है कि phase 2 reactions जो saturate हो जाते हैं, glucuronides खत्म हो गए, sulfate खत्म हो गए, these reactions now stop and the drug starts undergoing phase 1 reactions which leads to formation of a very reactive compound which is called N-aminoparabenzoquinone, NAPQI उसको कहते हैं। Normally क्या होगा कि it will be conjugated with glutathione और glutathione उसको harmless कर देगा। But then again we are talking about large amount of drug which will first saturate the glucuronide mechanisms, phase 2 mechanisms, it will pass to the phase 1 metabolism which will lead to formation of large amount of NAPQI which will be conjugated with glutathione, but then the glutathione stores will be depleted. They will be exhausted and then NAPQI will start damaging the liver cells. That is how it causes acute liver injury. This is all about biotransformation and the factors which can alter the rate of drug biotransformation. If you have any questions, feel free to ask in comments. Please like and subscribe for more content like this. Thank you. Finish.